Hey, yo, what it is, Doc Swig here. About to show you guys what it is I keep exactly in the battle pack as requested from one of my viewers. Alright, so let's go ahead and open this up. This is my actual line bag. As you can see, I use this when I go out on mission. Alright, so let's open it up, see what I got here. Alright, so this is like the same layout as I showed you guys before. Let's go ahead and dive inside the actual battle pack now and show you what's in this. Alright, so we got some 3-inch tape. It's going to be used for securing and taping down anything that needs to be taped down, which should be everything, all your interventions. Next we have MPA here. So it's going to be your nose hose and with some lube. 9 times out of 10, if you don't have lube, like on scene, just use a person's spit or blood. Going to have 2 CAT tourniquets here. These are priceless. I'll probably do another video on like how to use these, but this is also, I carry 2 of them inside this bag. Then we've got some occlusive dressings here, the Hyfin Chest seals. Can't beat those. I've got 2. 2 usually equals out to 3, because what you do is once you take the hyphen out, you can still use the plastic wrapping once you tear it in half, and that's 2 more chest seals that you got there. Just tape them down. These are just some training ones. Some training ones that I have here. The trainers are blue, so anytime you see anything blue, when it comes to like any type of interventions or an attack field, it's going to be training. So just remember that. So I got some TC3 card here just to write down all the interventions that were done. So when you do a patient handoff, you can hand this to whoever is taking the patient, and they can have a quick overview of what you've already done and in what disposition the patient's in. Next is going to be some Quikclot combat gauze. You can't beat this stuff. This is going to be impregnated gauze. So this has that this has the hemostatic agent in it. So when you apply this to a wound against that vessel, it's going to go ahead and help increase that clotting factor to go ahead and stop bleeding faster. Alright, so you got some Acewrap. I prefer Acewrap over ETBs just for the fact they're more versatile when it comes to wrapping different wounds in different areas of the body. With the pressure dressing, you guys already know when you wrap that, you have the pressure bar, and that can get a little touchy in some areas. So I prefer the Acewrap, multiple use, and you know, it's just timeless class item. Alright, next we got NCDs. As you can see, I'm carrying like a lot of tool stuff. The reason I don't carry one is because if something happens and I use one and I need another one, you know, I'm now asked out with that. So I go with the old saying, 1 is none, 2 is 1. You know what I mean? Alright, so NCDs here. So this is going to be for progressive respiratory distress. When I got a patient that has a collapsed lung, I can go ahead and drop in an NCD and you know, stop that tension pneumothorax from killing my patient. So if you guys want to learn how to use these as well, I might do a video on that also. I got a second nose hose in here, down loose. We've got some compressed gauze. Always gotta have the compressed gauze, universal. You guys can go ahead and pack on top of your Quikclot combat gauze with this, and just go ahead and add that added pressure. So when you do your final wrap, it adds enough pressure to go ahead and wrap against that wound and stop that bleed against the vessel. You can also use this for head wrap or just anything else that you want to wrap once you've cleaned up the wound. Timeless item here, better than Curlex in my opinion, because it's just a lot more complex, compressed, if you will. I carry 2 of those as well, and that's what it is mostly inside of the battle pack that I carry. I've seen guys put chem lights in there just to go ahead and set up a quicker CCP and all that stuff when it comes to TCC care. So we've got the abdominal dressing and the donut. I'm pretty sure I showed you guys that already. In this bag also carry the Cric Kit. That's gonna have everything in there, and of course cravats. Add some extra wraps if need be, and that's pretty much it for the battle pack, you guys. That's all for today. If you guys got any questions or comments, go ahead and drop them below, and I'll see you next time.